In today's episode of the Patient First podcast, we are going to talk about medical dental integration, what we've done wrong, what we've done right, and the work that has left to be done. It's brought to you proudly by Dental Standards Institute, doing the work to put patients first, patient advocacy, and empowering the emerging technologies in dentistry. To learn how to get involved with standard development in dentistry, go to dentalstandardsinstitute.com. Enjoy this week's episode. Hello, friends, and welcome back to the Patient First podcast. I'm your host, Dr. Bryan Laskin, and today we're doing one of my favorite things, which is present some new ideas. And let's face it, present some new ideas, things that I think have gone a little bit wrong. At the Patient First podcast, one of the things that we like to do is fundamentally shift people's ideas of what's going on in the marketplace. I like to call this technology because every technology, at some point, the pen was a piece of technology. At some point, a TV was like a revolutionary piece of technology. And ideas, I believe, procedures can be technology. And we have a macro trend going on right now that I would like to talk about that I think is going a little bit off track. And I'd like to steer us on the right way. And we at Toothapps are doing what we can to help steer that ship. But what I'm talking about, my friends, is a big, broad category called medical dental integration. It's a buzzword in dentistry. Actually, in medicine, it is too. If you haven't heard of this before, it's really just talking about the basic idea that for some reason we haven't focused on for way, way, way too long. That this might be shocking to some of you, but your mouth is part of your body, right? The oral cavity and what goes on there, tons of research shows that there's, I think it's 157 determinants of systemic diseases that show up in the oral cavity. And so there's this link. It's funny, we talk about the dental medical link. Well, obviously, there's no separation, right? Your mouth is a essential part of our body to the point where there's whole segments of people called dentists that treat this area, including myself. And so obviously this is a big deal forever. Why right now where it's becoming a buzzword, I have no idea, but it's a good thing because we have been disintegrated for far too long. There is no difference between medicine and dentistry in our bodies. Now, there is some nuanced ways that we treat dentistry that's different than medicine, not just from a clinical perspective, but dental insurance. Holy crap, is that different? I mean, it's broken in dentistry. It's broken in medicine, but it's way more broken in dentistry. But I digress. That's not what we're talking about today. But that is a key piece, actually. If we're going to truly integrate medicine and dentistry, we have to figure out the gaps in how we pay for these procedures, which is a whole nother talk show that maybe we'll do at another time. But today what we're talking about is what is the first real significant step that I've seen and why I think it's a misstep. So I think we're getting off to a rough start with medical dental integration, frankly. And it's really important in dentistry. We all recognize it. Frankly, physicians recognize it. About 1/3 of periodontal patients, so people that have periodontal disease, have diabetes, right? And we've known this for a long time, for a very long time, since like I was in dental school time. So about 25 years, this has been known. So, and frankly, it just makes sense. You have this bacteria in your mouth that's noxious. It's obviously going to have an effect on your overall health. So everything from diabetes and obesity and heart disease, there's numerous amounts of negative systemic manifestations based on your oral cavity, and also overall health, medical problems that we see first in the oral cavity. So it makes all the sense in the world. So in our massive knowledge base now on this topic, what is one of the very first significant steps that I've seen that has happened recently? Well, my friends, it's that medical professionals are applying what's called SDF, or silver diamine fluoride, which is a great procedure for a lot of people. What it does is it kind of arrests decay, so it stops cavities. So there's a code now in medicine to apply SDF. So in our infinite wisdom, I'm saying sarcastically, we are, instead of creating medical dental integration, we're going to have our healthcare professionals which that's a whole different segment of mess, right? Who charge way more than we do in dentistry. And frankly, do they know anything about treating caries? Has dental decay? I have no idea. And what are they going to do if that decay is in the pulp? There's all sorts of issues here that we, are they going to at least let a dentist know that this is going on for the patient? I'm not even saying that this is bad, right? I think that having medical dental integration is vitally important because we can help a lot of people. But this is like saying, part of medical dental, so on the medical side, they're going to start treating tooth decay. So how about we just start, I don't know, treating diabetes at the dental office? Why don't we start giving insulin? It just doesn't make sense, right? What makes sense is to actually integrate these two so that we make it easier for there to be a handoff. Why is there no, for example, ability for a dentist to see the medical history that every physician sees? Well, we've actually made that possible with Toothapps, right? I've talked about it here before, but we have this what we call connected dentistry, where we connect all your data within dentistry, but then also importantly, connecting dentistry to medicine, so that let's say that a physician believes that there's dental caries, they can send the information to a dentist or to a dental hygienist therapist or to somebody in the dental sphere that treats dentistry. Another way to look at this problem is that somewhere between 20 and 30% of physicians are general physicians, so they're family physicians. The other 70 to 80% are specialists. So does it even make sense that we're having this narrower band of physicians be treating dental patients by treating decay? Absolutely not. I mean, there's one specialty that should be treating that, and it's the specialty of dentistry, right? There's whole armies. We have our own schools, we have our own practices, and frankly, we're cheaper, handled totally differently than medicine. And so it just doesn't make sense. Again, what are we really looking to do here? We're looking to put patients first. Does that mean that silver diamine fluoride or SDF should be placed in a medical practice? Sometimes yes. If it's a remote care somewhere where there aren't any dentists available, or in some cases it does. I'm not even against obviously having medical professionals treat dental issues in some capacity, right? It does make sense. But what I'm saying is it doesn't make sense to try to solve this huge issue of medical dental integration from the bottom up. Let's solve it from the top down. And the way we do that is by giving dental professionals access to the information that's vital on the medical side and the other way around, and creating the good communication, the referral patterns and passage of information, the true interoperability, and truly integrate our processes prior to trying to just have people on one side or the other do what that team's already doing. We don't need other people to be placing SDF. What we need to do is have people with dental caries who are in a medical practice go to the right provider on the dental side, and people who are on the dental side, if there's a medical condition, that we can do the same thing back to medical practices. So hopefully this helps. If you have questions, if you disagree with me, if you think that, we should just have physicians be treating as many dental procedures as they possibly can, or we should be doing open heart surgery in dental practices. I mean, that's an extreme case, but if you disagree, if you have other thoughts that you'd like to, please place them in the comments below. If you like the podcast, obviously subscribe. I loved hearing from our subscribers, which are growing every week, and thank you for that. Tell a friend if they're in the dental industry, if you're a patient, share it with your dentist, and maybe they'll learn something. Thank you very much. As always, I'm very honored that you listened to the Patient First podcast this week, and I'll see you right here next week. Take care.